Good afternoon. We are here live on Facebook with Megan Avallone, Director of the Westfield Regional Health Department. Hello,
Hey.
Megan. Thanks for coming, and thanks for having a chat with us about some summer safety tips. We have a series of questions that we're going to ask you, and then we'll open it up if anyone who's watching has a question to ask.
Fantastic.
All right, sounds great. So tell us, what are some essential wildlife safety tips people should be aware of when spending time outdoors in our region?
This is a great question. The bulk of our wildlife complaints and concerns come in during the summer months. So the number one thing is feeding wild animals is not a good idea. I'm an animal lover. I love animals. I really love cats too. Feeding of wild animals only harms them, and that includes cats, right? So as cute as a fox may be or a stray cat, it's best just to leave them alone. Just seeing a fox or a coyote is not cause for alarm. Even seeing a raccoon during daylight hours, if it appears healthy, is not a reason to be concerned. As long as these animals appear healthy and don't and are, especially if they're scared off by human presence, this is something that we would anticipate and not a reason for residents to be alarmed. But animals that are aggressive or that appear sick should be reported to either the police department or animal control. And then when you're outdoors, especially if you're walking some trails or in the parks, dogs should always be on a leash. This is really to protect the dogs and really to provide them with some sort of barrier in case they are encountered by a wild animal.
Okay, so you mentioned seeing a raccoon outdoors during the day is fine if they appear healthy. What should you look for to determine if it's unhealthy?
Yes, so for any of the mammals, fox, coyote, raccoon, there are going to be several things that we're looking for, right? Number one is if they have trouble walking, you want to report that. If it feels like, if it looks like they, are maybe walking in circles or really can't stand upright, you definitely want to report that. And if they're not scared off by human presence. So, for example, if you're able to get close to a raccoon and they don't run away, or if one of these animals approaches you and doesn't seem scared, we want to know about that as well.
Okay, and when you say reported, who do we call?
Either the police or animal control.
Okay, great. Are there any specific precautions people should take when encountering wild animals, such as snakes or bears in our area?
Yeah, so the first is, this time of year, people are spending more time outdoors, right? So we want to make sure that if you are in an area like a park or a trail where these animals live, you want to be extra alert, especially if you're active in these areas at dawn or dusk, right, or in the evening hours. So you want to really be extra alert of your surroundings at all times. If you come in contact with a bear in particular, you don't want to run, right? You don't want to make eye contact. What you want to do is, generally speaking, the vast majority of times, if a bear sees a person, they're going to run away, right? They're scared by us. But if for some reason you find yourself in a situation, you want to make yourself appear larger than you are. So hands above your head and scream, "Go away, bear." If you're an avid hiker, it's also a good idea to carry maybe some sort of like a blowhorn with you so that if you come across a wild animal, you can make a loud noise and hopefully scare them off.
Okay, so I've been told that you clapping.
Yeah, when you're walking a trail or, if you're in a wooded area, you always want to make sure wild animals are aware of you before they see you, right? So I do a lot of hiking and we, clap from time to time. I talk, right? And you really want to make sure that you don't startle any animal.
Mm-hmm. Is it necessary to carry bear spray?
I don't know if it's necessary, but it's certainly not something that we discourage, right? If it makes you feel better, I definitely think that it's something that residents can do. You can buy bear spray at any REI or outdoor shop.
Okay, great. Can you provide specific advice on how to protect yourself from vector-borne illnesses like Lyme disease or West Nile virus that we can catch when we're out in the woods hiking? What about the cases of malaria too in Florida? Do we need to worry about that?
Yeah, so definitely you're going to be more likely to come in contact with a tick or mosquito, right, than you are a bear or coyote. So these are concerns that we really hear a lot, and these are really things we want residents to know how to protect themselves. So for tick-borne illnesses in particular, there's 6 things that you can do that are really going to reduce your risk. The first thing is in your home, you want to make sure that your property is clean and that the grass is cut. And if you are outside in some sort of a park or a trail, you want to make sure that you avoid uncut areas. So stay in the middle of that trail. You want to use insect repellent when you're outdoors, right? So insect repellent, it's going to be EPA registered, and it's going to contain either DEET, picaridin, IR3535, or oil of lemon eucalyptus. Oil of lemon eucalyptus is only really for use for children over 3, but all the others can be used in children 2 months or older. You want to inspect yourself when you come in from the outdoors, right? You want to do that tick check for yourself and any children you have in your home or elderly people. Common places you want to look are behind the ears, the nape of the neck. You want to do a scalp check. You want to look in the folds of the skin, behind the knees, in the groin area, things like that. Also, if possible, we want you to shower within 2 hours of coming in from the outdoors. You can also wear long sleeves and pants when you're outdoors if you know the area to be heavily tick infested, and tuck those long pants into your socks. And then if you have pets, right, it's really important that you use tick preventative on your pets to reduce the risk of them bringing a tick into the home.
Okay. So I've been told, and even my husband doesn't like to use DEET. I've been told it's harmful. Does oil of lemon eucalyptus work?
It does. It really, really does work. On our website, we have a great graph that tells you the hours that it works. And putting it on once, any of these on once for a 12-hour day, right? It's not the best, right? They all have different reapplication times. So definitely always follow the instructions that are provided on the label. And I know you had a question about mosquitoes and malaria. So right now, there are some parts of the U.S. that are seeing domestically acquired malaria, but those are in Texas and Florida, not in New Jersey at this time. But the same bug sprays that work for ticks are also going to work for mosquitoes, right? So if you're out at dusk, you're probably going to want to protect yourself from mosquitoes, because we still see lots of mosquitoes testing positive for West Nile virus and other vector-borne diseases in this area. And then the most important thing residents can do for preventing mosquito bites is really keep your properties in a situation where they're not going to have standing accumulated water. So really what that means is make sure those gutters are clean, make sure you don't have any tarps, make sure children's toys are put away, bird baths, make sure that they're emptied, and really mosquitoes just need a really tiny amount of water to reproduce. So you really want to check your property continuously to make sure you don't have standing water.
Okay, great. What are precautions pregnant women, children, or individuals with compromised immune systems can take to minimize their risk of contracting one of these diseases?
Yeah, people with compromised immune systems are at risk for, more severity of all diseases, right? So we really do want to make sure that they're protected. Definitely what they should be doing is wearing those insect repellents when they're outside, using those protective clothing, consider the longer sleeves and pants. And for toddlers, babies that are in a carriage, if you like walking outside, you might even want to consider, they sell netting that goes around the carriage to prevent the baby from getting bitten by mosquitoes while outside in the carriage.
Okay, so you mentioned clothing a couple of times. Could we talk for just a minute or two about selecting appropriate clothing to protect against these kind of vector-borne illnesses, but also wildlife encounters?
Yeah. So, what ideally, right? If you're out in woods that are tick infested, mosquito infested, ideally, right, it's nice to have a long sleeve, even if that is a lightweight long sleeve, and long pants. Shoes that are going to cover your foot so that if you do encounter a snake, rattlesnakes in particular are what we're worried about. You can have some protection there. And then in terms of clothing, this time of year, especially if you're fair-skinned, it might not be a bad idea to have a hat that protects you from the sun as well.
Great. And there are rattlesnakes nearby?
I don't think there are any in Union County, but certainly Sussex County if people like to go hiking more up north.
Okay. Are there any local resources that people can access for more information or assistance about wildlife safety and these kind of vector-borne illnesses?
Yes, we have so many resources on our website. Really great resources to find out which sort of insect repellent is best for you and your family members, and information in detail about how you can really protect yourself and your family members.
Okay, so let's talk about some of the signs or symptoms that we need to look for and be aware of, and when to seek medical attention.
Yeah. So for these vector-borne illness, one of the frustrating things for healthcare providers, residents, and myself in the health department is the symptoms are also are often non-specific, right? So if you spend time outdoors and then you develop things that feel like a summer cold, a summer flu, a fever, anything that makes you feel off, if you feel as though you may have recently been bit by a mosquito, you might want to discuss that with your healthcare provider. That's certainly something that we would recommend. Obviously, if you find a tick on yourself and then you develop symptoms, you might want to let your healthcare provider know. But one thing that we always say, everybody knows the bullseye rash is a sign of Lyme disease. But more times than not, people with Lyme disease who end up testing positive don't have any recollection of a tick on them, right? So we always say it's the tick you don't find that we're concerned about, which is why those checks are really important. But for this time of year, if any resident has symptoms that they feel are concerning, definitely discuss that with your healthcare provider.
Great, because we've all heard stories about people who have suffered with Lyme disease for extended periods of time, or have felt terrible and then finally figured out over time that it actually was Lyme disease.
Right.
So what are very specific symptoms for Lyme disease?
So Lyme disease, the thing that's tricky is it varies person to person, right? We typically get people have achiness in the joints, sometimes swelling in the joints, feeling really tired. Those are the main symptoms, and obviously that bullseye rash is really the indicator as well. But what I would say is if individuals feel off, they should definitely talk to their doctor.
Okay, so we're not encouraging people to worry about this, any of these things too much, and to still go out and enjoy the outdoors. But how do you balance these concerns and being outside and enjoying summer?
Yeah. For sure. Getting outside is great this time of year, right? Getting that fresh air and being active is something that we definitely encourage. What I would say to residents is you just want to do your best at being proactive, right? So, we do a lot of hiking in my house, but we also, use a lot of bug spray before we go out, right? My children are very, very fair. They're always outside, but we use lots of sunscreen, right? They're wearing a hat most days. So I think it's just, enjoying the outdoors, but really making smart choices that are going to keep you healthy as well.
Okay, great. So you mentioned bug spray and clothing, using different types of clothing as effective methods for repelling mosquitoes and ticks, especially during the peak season. Are there any other methods that are particularly effective that people should consider when they're spending time outdoors?
Yeah, I think the most important thing is really to be smart about where you spend time outdoors and to really be proactive with your own property. For example, when we go hiking as a family, I make sure that my kids know to stay in the middle of the trail, right? I don't want them on the edge of the trail where that grass is high, where ticks are likely to be. My property, I make sure that the grass is cut and that there aren't a lot of objects that can collect water. So I think it's about just being aware of the environment.
Okay, great. So there are some companies that spray residences and properties for mosquitoes and ticks and even deer. What do you think about those options? Are they dangerous to humans or pets?
So every person or company that actually sprays insecticide needs a licensed pest control operator license, right? And there's rules set by the state and by the federal government, the EPA, as to what you can spray, how you can spray it, and all those licensed operators, to get the license, they need to be aware of those rules. One thing that I can tell you is keeping, for mosquitoes in particular, right, keeping standing water off the property is going to be super, super effective, right? And for ticks, keeping that property neat and clean is also, leaf piles is another thing that we commonly see, ticks in, right? You want to get rid of those leaf piles as well. So those are going to be super, super effective also.
Okay, great. So you mentioned these companies needing to have a license. Mm-hmm. How do you find out if a company you're researching is licensed?
When you call, they should be able to provide you with that license number. And there is, at the DEP website, there's a list, I believe, of all individual companies that have a license.
Okay, great. Okay, going back to sunscreen for a moment. Are there any common misconceptions about sunscreen that you would like to address?
There sure are. The first one that we hear over and over again is darker-skinned individuals really don't need sunscreen. Everybody should be using a sunscreen with SPF 15 minimum if they're spending time outdoors. If you're fair-skinned, you might want to consider SPF 30 or 50. Also, you really have to make sure that you're using enough sunscreen, right? So for the lotion-based, what we say is a shot glass full for your body, average size adult body, and then an additional half a teaspoon for your face. If you are using the spray sunscreens, which are popular, you want to spray it into your hand first, and then from that way apply it to your body.
Oh, so you don't spray it directly on your body?
You get more direct application if you spray it in your hand first and then rub it in.
All right, good to know. How frequently should sunscreen be reapplied, and what factors should people consider when determining the appropriate SPF level for their skin type?
Right. So SPF 15 we recommend as a base for everybody, right? And if individuals tend to burn, get sunburn quicker, probably a 30 or 50, and then for lighter skinned children, probably a 50. You want to reapply every 2 hours, but that every 2 hours is just for sitting outside, not sweating a lot, not swimming, right? So every 2 hours reapplication, and then also reapplying after after swimming, after sweating a lot, or after toweling off. The other thing too, for people who like recreational bathing, you want to make sure that the sunscreen has a chance to actually get in the skin before you go do that bathing activity. So you want to wait like at least 10 minutes after applying sunscreen before getting into the water.
Mm-hmm. So what SPF sunscreen do you use on yourself and your kids?
So I have darker skin. But even that, I still use a 30 because I don't want to age. So the great thing about sunscreen is it also prevents premature aging, right, of the skin. So I use 30 on myself, and then for my kids, I use 50. So, it's a matter of preference. The most important thing, though, for residents, the takeaway is sunscreen really should be used and reapplied every 2 hours.
Mm-hmm. So are there any specific ingredients or types of sunscreens that are more effective or safer than others? What do you look for in a sunscreen?
Yeah, so it's all a matter of personal preference, right? You want to make sure that the sunscreen you have is broad spectrum, which means it protects against the UVA and UVB rays. There are really two different types of sunscreens. One that is chemical-based and ones that are mineral-based. It's just a matter of preference which one individuals like. One thing, sometimes we hear about residents saying, well, I made, a homemade sunscreen. Homemade things from scratch are great for most things. Sunscreen's not one of them, right? So you really want to make sure that, that you're using that broad spectrum, either, the chemical or the mineral based.
Great. And what if I'm wearing a swim shirt? Do I need sunscreen?
The swim shirts that you buy today will have like an SPF in them. So if it's an SPF, usually they're SPF 30 or higher, and it should be fine.
Okay, great. What additional steps can an individual take apart from sunscreen to protect their skin from sun damage and reduce the risk of skin cancer?
Yeah, so we want to do things like if you're very, very fair-skinned, right, wearing that hat is really going to help. Wearing sunglasses is going to help protect your eyes as well. The sun is strongest from 10 to 4. So if you have activities to do during the day, either before that time or after that time, and also you can check the UV index day to day, right? So on a day like today where we are, it's a little cloudy, the UV index is going to be less than on a bright sun-filled day. And really just make sure that you have enough sunscreen with you. A lot of times people will put it on before they leave the house for a full day and not have any with them. So you want to make sure it's always in your bag for reapplication.
Good idea. Do you have any tips on how to properly use sunscreen for maximum protection against harmful UV rays?
You want to make sure you use enough. And this is hard even for me, right? I put a little bit on, but you really want to make sure you use that full shot glass full. Also, you want to make sure the sunscreen is not expired. Sometimes you keep it in the beach bag and you use it year to year. The typical expiration date for a sunscreen, I believe, is about 3 years. But at the beginning of the season, just go through all your bottles to make sure that they're not expired. And then obviously, if you're out for a full day of fun, that's great. That's what we want to hear. But just remember to reapply after swimming, after, a sweaty activity, and make sure that, you have it with you.
Great. So I was at the Summit Family Aquatic Center, and we were asking people to see their sunscreen as part of a Good Morning America piece. And a lot of people had expired sunscreen in their bags, and they also went to a store, to a ShopRite, not near here, but they bought 5 or 6 expired bottles that were still on the shelf.
Well, you know what? We can certainly check for that when we go into places. That is fantastic. And residents too, when you're purchasing, right, just like you would a food item, check. Make sure that before you purchase, it's not expired.
So where do you look for an expiration date on sunscreen?
It depends on the bottle, but typically it's by the label with the instructions for use and the ingredients.
Okay. All right, great. Well, Megan, this has been a lot of really interesting information. Do you have anything else that, we don't have any questions coming in. Do you have anything else that you want to share?
No, health department's here as a resource. This is a great time of year for residents and for us as well, right? So we hope residents get out there, enjoy the beautiful weather. Feel free to check our website for resources, and if they have any questions, they can just contact us.
So what is your website address?
So you can link through the City of Summit website or directly at www.westfieldnj.gov.
Okay, great. All right, thank you.
You're welcome. My pleasure.